got, right? Hey, this is Cynthia Tieche here with Dr. Tieche from Recharge Clinic in Ocala. Got Goofy over here trying to make faces.
I'm not making faces as much as, well, I was trying to make some faces.
Yeah.
Because, doing a radio show with your wife is like almost doing it with your mom to an extent.
What?
Yeah. Not in that it's weird like that, other than no matter what I'm doing, she's over here correcting me. Don't fiddle with the papers. Don't make that face. Hold your water like that. Fix your eye.
No,
fix your hair. Look at your shirt's messy.
Smile. Just smile because,
yeah.
I have RBF, resting bee face, and you have it as well. So
No,
we don't smile. We look like we're mad.
I have RDF.
Yeah, resting dick face. I
Yes.
can say that, right?
Yeah. Well, you said it.
Okay.
It's out there now.
Yeah, well, if you watch this on Facebook...
I'm like a Cadbury egg. I've got a crusty exterior. But
Crusty, is that what you want to go with?
Hard.
Okay.
But I'm very soft and sweet inside.
Well, I don't know.
Anyway, that's what I like to believe.
No, but on this show, on the Facebook part of it, it's like Facebook is out to get me. Because the thumbnails it chooses for this show are crazy. Pretty
So
crazy.
for you who don't know what a thumbnail is, as I did not
Oh,
either.
yeah, he's like, what's a thumbnail?
A thumbnail is, it goes through the program and periodically will snap a photo, and then somehow it randomly decides that's going to be the photo that is going to be at the beginning of what people are going to see when they scroll onto that page to view it. Yeah. How it's obtained, we don't know, because we've sat here many times smiling the whole time as hard as we could.
At the
and
beginning,
guess what?
because we thought it would be from the beginning.
And
no,
we thought it was
not.
at the end. At the end, we're sitting here like two idiots smiling as hard as we can, and then it would usually be something like me staring at the wall and
I
picking
talk
your nose
with my
or
hands.
something.
No, I talk with my hands, and apparently I make a lot of faces because there have been some crazy ones, and I'm like, oh my gosh, we need to fix this right away.
The best one looked like you were eating the microphone.
And my hands were out. And
you're like,
yeah, it was ridiculous. It was ridiculous.
Ridiculous.
Then I went in and tried to, let me look for a better thumbnail. And I'm like, okay, every thumbnail, I look like a freak. I'm like, do I look like a freak the whole freaking show? Because it wasn't a lot to choose from. No comment? You're not gonna say
not at all.
Yeah.
Never. I've never seen you look like a freak.
So,
anyway,
we are going to start with some weight loss tips. So, weight loss, blah, blah, blah.
Really?
My weight loss tip today is if you don't want to do it, you probably won't do it. Because I have seen that over the years, of course, forever, and I'm sure you've seen it too. If you don't know who I am, not who I am, obviously you know who I am, you're watching the show, but where did I come from? How did I end up talking about weight loss? So weight loss is something that I have a passion for. That's why I got with you, because it was just my goal to help you, right? Actually, we didn't meet that way. So I started out as a personal trainer, and I was a personal trainer for a long time. Even though I'm only 24,
long time.
I was a personal trainer since I was born. So I've seen over the years many clients, and if you're not really 100% into it mentally and emotionally, you are going to struggle because you're just really not going to be committed. But my first client I ever had was my dad. And actually, in my mind when I was a kid, he always had a bad back, and I always wanted to help him. And so when I became a trainer, I knew if he had lost some weight, that would help his back issue because he had a little weight issue. And some of my family did have weight issues. Not anymore, but they did.
I think you even quoted that somewhere.
Okay, so pause that, and we'll talk about what he just mentioned. I was in a magazine, I don't know, it was like 10 years ago, and they were interviewing me as a trainer, and I don't know, I guess I was just an idiot when I said this, because I wasn't even thinking, I guess I just wasn't realizing that, people were going to read it, and I wrote, and this is online. You can find this if you search my name, which sucks. But I said, well, I come from a very overweight family and blah, blah, blah. That's what got me into it. But it is true.
It is true. But
I'm an honest person. Sometimes I just don't realize the things that I say.
A little too honest. And so interestingly, that gets put out in the magazine. She's so proud to show her family her article in the thing. And the first thing they read is, overweight family. Gee, thanks. And
But
to go along with that as another side note, yes, she's very upfront, and sometimes we are both very passionate about this. And I just want to step back. That I don't want to make. I want to make sure that we haven't offended anybody when we have talked passionately about people being overweight. Sometimes we get a little worked up about it when we talk about some people being fat and heavy.
I never
and all
used
of
that term.
Well, I've used it, and being heavy and overweight and stuff like that. And we certainly don't mean to be offensive. We have a weight loss clinic. We embrace these people. We try to help everyone. That's our main goal. But we talk about it mostly in noticing how we know that there's an epidemic of obesity and it's everywhere. And no matter where you go, you're going to see it.
It's just,
but we don't mean to be offensive. We certainly don't want to turn anyone off.
No.
Listen. I struggle with my weight all the time. And so does everyone in my family as well. So,
everyone in my family and me.
So
I'm always watching what I'm eating.
Certainly, we're not trying to beat anyone up by that. So if it came across that way, we certainly apologize. I certainly apologize. Cynthia certainly apologizes.
So my passion in life has always been to help people lose weight. I don't know why. I guess maybe I'm really a nice person inside and I want to make them happy. And I know that if they felt better, they'd be happy. But
Is there another maybe in there?
Maybe what?
Maybe another reason?
No.
Okay.
I remember when I first became a trainer, I don't know why, but I love helping people lose weight. I don't know why, but you just see a different person. And then when they lose their weight, I would take my clients clothes shopping or anywhere, get them back out, because I've had people that have lost way more than 100 pounds often. And they just were a completely separate person. And then when they lost that weight, it was like they were reborn. And I remember that was one of my favorite things, was to take them out and just kind of get them restarted in life again. I love it. And that's actually how Recharge came about. Was, of course, he probably wanted to do some new things, but I really wanted to open up a medical weight loss center where we could take everything that I know and then add all of the medical side to it that he knows and make it work for people. So it is something I am extremely passionate about. So my dad was my first client, worked out, but you know what? He really wasn't mentally there yet. He did good, but did not lose all of that weight. So fast forward like 14 years or maybe a little less than that. And when we started our weight loss center together, my dad was one of our first patients, and he lost over 100 pounds with us at this medical weight loss program. And
has still kept it off.
And has still kept it off, feeling like he is a new person.
Oh,
honestly, I was talking to him last night, and I was looking at him, I'm like, he is not the same person he was 5 years ago. Not. And actually, when I post his pictures on Facebook, people think it's a different person. To me, it's like, no, I can see it's the same person, but he does look like a different person. But he was mentally ready, and we looked at hormones, and we were comprehensive about the whole thing, the whole package, and made it all work. And he went shopping, and I mean, it's so cool to me. That transformation is so cool. And when I see people overweight, I just really want to help them. But I know, of course, I can't approach them and say that, but I love it. I always this is like living a dream that I can do this now, helping people lose weight still.
What's really
day.
cool about him, knowing him, he is a great cook. He's always been a great cook. And, being Italian, loved to cook all sorts of pasta dishes, very delicious, calorically dense foods. And then he made the transition that when he started to do this stuff, first he ate salads, but then he did a lot of research on his own and now prepares all of these low glycemic, low carb dishes that are freaking amazing tasting. And every time he's got another new one, and he takes, just puts a spin on something. So he's used that instead of just sitting there sulking, saying, I can't eat anything that I want, and just eating a salad and complaining. Took it and said, listen, we're going to eat delicious food, and has done that. And so it can be done, and it is cool. I mean, to see him in really great health now. I mean, he's in great shape, really physically
running circles around most teenagers and
really
everyone pretty much.
Fit, and much more mentally fit, because you know what? I think part of it, he was depressed when he was bigger. So he's not so depressed. Very much energetic.
Yeah.
Anyway.
Yeah, it's pretty cool, but we did that cooking thing with him. Remember?
Yes.
We did. I think it was last year. We had him come at Recharge Clinic and show how he made cauliflower crusted pizza. So instead of the crust, it was cauliflower. Oh, he needs to make that. Maybe this weekend we can get him to make it. Anyway, everything. Like, he makes so much stuff out of that cauliflower. It's crazy. He makes his own cauliflower, like, I guess, dough or whatever. Anyway, we should do that again. We should have him come and teach a little class because, I don't know, I still can't figure out the cauliflower. It's kind of hard for me. And then the that bread he made with the egg whites, cloud bread. Yeah. So, once you're mentally prepared, we believe keto is the way. And come see us if you need help. And if you need some ideas on recipes, then that's your man right there. He would be the one to see. Did you have a weight loss thing that you wanted to add?
One of the things I wanted to add with our diet is we always push water. Drink lots of water, you know. And so being in Florida and being in this tremendously hot temperature, how much water should you drink? I mean, that's a question that we get all the time. How much water should we drink? How much water should we drink? Well, on the average, people should drink, and this is a kind of an estimate formula. It's kind of a cool formula. And what you can, so everyone can figure this out, is you would take your weight in pounds, multiply that times 2/3, and that's the number of ounces you should consume on an average per day.
On average.
Yeah. So me, it would only be like 80 ounces a day. And anyway, in my dreams. But so, you know, for most people, that's a fair amount. Rough estimate for most people, just quickly, is going to be, you know, 64 to 100 ounces, you know, quickly 2 liters or a half gallon. But it's going to be much more than that. There's some estimates, you know, with this warm temperature and being outside, that people should consume at least 2 to 4 glasses of water each hour. And that's significant because I think that people don't really think about drinking that much water. You know, we drink a lot of water, but we don't. And I think that most people, a lot of times that we see, you know, we have a vitamin IV clinic, but we also do a lot of hydration. And we see a lot of people who I think are on the verge of being, you know, heat exhaustion, dehydration, all of this kind of stuff because they're symptomatic. And we're going to come back to that in a minute.
Yeah. Cynthia Tieche here with Dr. Tieche from Recharge Clinic in Ocala. You were just talking about...
We should maybe change the name. You know, we talk about coffee talk, but we're never drinking coffee here.
I know. We're drinking water.
We're drinking water talk.
Yeah, but it's like coffee talk, like that old Saturday Night Live show.
I know.
Coffee talk.
Coffee talk, I know. So I was talking about water and hydration, and that, you know, many people really being outside all the time, and we're out doing all kinds of activities, being by the pool, mowing grass,
Just walking
on a
from
boat,
the inside to outside, you lose a gallon of sweat.
Right, and how much water you're supposed to consume, which is never enough, basically.
No.
So I want people to know, what are some of the symptoms of that you are starting to get dehydrated, and that your intravascular volume, that's the amount of fluid that you have in your bloodstream, is starting to go down. What do you think the first sign of dehydration is? And we all experience it.
A little headache?
Dry mouth.
Oh.
So that usually means you're about 10% down.
Huh.
And so that's a great sign. When you start feeling thirsty, you better go.
Just talking about water is making me thirsty.
Yeah, it's making
Pretzels are making me thirsty.
Yeah. Anyway, so that's one of the other things that first happens. The next sign of things that start happening is fatigue. People start feeling a little more tired from that kind of getting a little bit less fluid in there. Now, if you happen to know and you're paying attention, you might notice that if you've been outside, you've been outside all day, been drinking water, and haven't gone to the bathroom one time. You don't urinate as much, and then your urine becomes more dark. The next thing is what you said, headaches. People start getting headaches. They're out in the sun. They go, oh, I'm getting a headache. It must be the sun. Well, it probably is the sun beating down on your head, but it also, that's a first sign of getting dehydrated. Dizziness, a little bit of dizziness. And the first thing you're going to know is when you bend down and stand up, you're going to get a little dizzy. And that's called orthostatic hypotension. That's when your blood pressure drops when you're kind of changing positions. So these things are all really important warning signs. Tears, you're going to have much less tears. And as things progress, all of those symptoms worsen. And so, it's important that when that start happens to kind of try and rehydrate yourself, if you can, certainly with water and electrolyte, things like that, as opposed to just drinking a soda or coffee or things like that. So, that was what I wanted to say. That was my tip about water.
I'm proud of you for talking about water.
Yeah, because it's not one of my favorite things to drink, but I do try, and I do drink a fair amount.
I love water. I just love drinking water. It's just so refreshing and satisfying. You have any more to add? Let me guess.
I do. I can't read it.
You can't read your own handwriting.
I can't read my handwriting.
He has some paper up here that literally looks like, I'm questioning, did I marry an Asian? And this is symbols. I'm not sure that...
I can read it now.
You figured it out?
Yeah, but it doesn't make any sense now.
Oh.
So anyway, we've had a lot of patients who have come in who have been out mowing their yard or just even been hanging out in the pool that have come in and needing some rehydration IVs because they've come in being dizzy. Their pulse has increased. That's another sign, a little bit later sign, your pulse increases, your blood pressure goes down. So if you start feeling like your heart is racing, you're getting very red, you can't cool down, you're probably on the verge of, getting that way. So that's when you really want to try and cool yourself off and drink fluids. And these people, we've given them multiple liters of IV fluids to hydrate them before they've actually had the sensation of thirst going away and them wanting to go to the bathroom. So it's pretty insidious in Florida because we don't pay attention to it because we sweat a lot. In areas where you're dry, you may notice more of a dry mouth, but here you instantly start sweating because we're so hot, but you're wet. And so you kind of get the false illusion that you're wet, so maybe you're not getting dehydrated, but you are. Because as soon as there's the temperature thing, that's when you start kind of evaporating it. So it's something that to be considered and something that's important, particularly your kids. Your kids are out playing around,
yes.
running around. The adults are pretty much sitting under a tree drinking a beer or drinking a pina colada. The kids are out there running around in the sun, not paying attention to it. So anyway, something to mention.
Yeah, it's a good topic because, it's pretty hot out there, and we have seen some people come in not feeling well. So make sure you're drinking that water. And it's not just drinking water while you're outside. You should be drinking it before you even get outside.
Well, you should when you get up. And this was an interesting thing that I found in there about talking about people should get up and drink 16 ounces of water as soon as they get up. And I've read this before. And what it does is, you from being flat in bed and going to the bathroom and stuff at night, your intravascular volume, which is the amount of blood you keep in there, has gone down a bit. So that when you stand up, you are a little bit dehydrated. That's why some older people who are on blood pressure medicines feel a little dizzy when they first stand up and they have trouble with their footing. Younger people typically can compensate very well for that. But that being said, all of them have lost some volume as far as fluids. So drinking this amount of water kind of rehydrates you and gives you boosting. Now, one of the things was there was an article that compared drinking a large glass of water to drinking a cup of coffee. And what they found is that people who didn't really know what they were drinking, and I don't know how you would know, but they felt the same amount of alertness after that. And they said, so they didn't really attribute so much the coffee in the morning as to the caffeine because it wakes you up much quicker than what the caffeine could be working. So what they postulated was that it was the volume of the coffee giving you that increased intravascular volume equal to what a glass of water would do. So anyway, something to consider. I still like my coffee in the morning, so I don't know that I'm going to have a glass of water and I'm going to get rejuvenated, but it does do that. I remember my grandmother would do that. So when she'd get up, she'd drink a big glass of water.
I do. I'm dying of thirst when I wake up.
Yeah.
It's like I was in the desert or something. I drink quite a bit. Then I'm, peeing the rest of the morning, but whatever. So you had some interesting things you wanted to discuss today.
So there was another thing. When I was kind of researching the water thing a little bit, I came across fat-burning drinks because, we're all looking for
going
different
from water
things.
to this?
Well, it's not just now.
And he wouldn't tell me. He said, I'm going to talk about some drinks that burn calories. I said, well, what are they? He's like, you'll just have to find out.
Trying to build the hype. Create a hype. Create a buzz.
Let's see if I approve.
Well, hey, I didn't come up with this, so this is stuff that I found. I'm not saying I'd drink any of them. I can tell you there's some of them that I don't drink. So the first one was green tea. And green tea's got stuff in it called matcha, all right?
Okay,
I have all
without
time to say
sugar.
it. It's MATCHA, which is a substance that's sort of concentrated in green tea that's been associated with increased lipolysis or fat burning. The other thing that green tea does have is caffeine, which also, even though we know it's a stimulant, actually does help burn calories. So it does kind of increase your basic metabolic rate. So green tea is good because it has those two things in that matcha and the caffeine in it.
Okay.
Anyway, so that's one that's there. Coffee. Honestly, coffee's was on the list for fat burning drinks because,
Really?
again, of
Caffeine.
the caffeine, increasing the metabolism. Then there's black tea. So black tea is, as opposed to green tea, which I didn't realize what black tea is much stronger. And it's stronger because they roast the leaves longer is what it is. I thought it was a whole different variety, but it's really the way they prepare the leaves. So it's a much stronger form of tea. It's more oxidized. So it is has a lot more antioxidants in it. So that makes the black tea actually a little bit more healthy for you. But it also has the same amount of caffeine to it. So you're getting that calorie burn, but you're also consuming more antioxidants, which is our continuous plight to fight off oxidative stress and all of the results of oxidation. So that was kind of cool. Then on the list was water. And so water, water does. They talked about helping with weight loss because if you drink a big glass of water, it helps give you the sensation that you're full. So that's one thing. So they recommended people that are dieting to drink a glass of water before they ate every meal, because definitely you're going to be full. You're not going to want to consume as much because you're going to feel that way. And so people who drank water before. So they did a study, which just seemed like a stupid study, but because it seemed like it would be obvious. But people who did drink a glass of water before and people who did not basically consumed the same amount of water. What they were trying to say is it also does matter how you consume the water, not the total amount of water you consume. So if you consume the same amount of water of two different groups of people, but some of them took that water and they consumed it right before they ate, those people typically lost more weight.
Interesting.
Which makes sense.
I mean, of course, that totally makes sense, but not everyone thinks about that. So that's something to try: is drink some water. If you're trying to lose weight, drink some water before you start eating. Of course, I mean, and some people think that they're hungry when they're really just thirsty.
That's true. Another thing I think people should do is, particularly if they're really hungry, I think they should do the water or some form of liquid first, because when you're really hungry, you tend to really just, before your brain can send the feedback loop to your full, you've already consumed way excess amount of calories.
Yeah.
So maybe it can set that little bit of a, reset that barrier down a little bit. Yep. So the other thing, and this one I think is going to be a little bit hard to palate, but this was on the list, was apple cider vinegar. And so, I take apple cider vinegar capsules because I think it's
It is so good for you.
It is good, but to drink it, I think it's a little gross.
I've tried to drink it.
But the capsules work well. So acetic acid, that's what the vinegar is, helps lower insulin levels. So lower insulin levels promote fat loss. Insulin is one of the substances that stores glucose in the form of carbohydrate. So it wants to save everything. So the lower we can get lower circulating insulin levels, the better it is. That means we're not gonna be storing all that fat. We're gonna be in a catabolic state. It slows stomach emptying, which is interesting because that gives you the sensation of prolonged fullness. So you stay fuller longer. So that's another thing.
So if you're taking the capsules, should it be right around when you're eating?
It didn't really say so much about it didn't compare the capsules that I read, comparing capsules to the liquid. It just talked about the liquid. And
I'm sure the liquid's better.
Well, I'm sure the liquid is better, but I'm sure if you drank some apple cider vinegar before you were going to eat, you probably didn't want to eat anything anyway because it made you want to vomit.
Yeah.
I mean, it's pretty hard to palate, but the benefits of it are amazing. So I recommend trying to do it, or at least maybe trying to get the capsules in there.
He's drinking his water in there now.
Is he drinking his water? I got him good.
If you haven't already picked up a cup of water, what are you waiting for?
Exactly. You need to be drinking 2 to 4 glasses per hour. You're already down one.
Yeah.
Ginger tea. That's the next on the list.
Oh, we're not done with the drinks?
No, I'm going to tea. Remember I said drinks. Ginger tea.
Oh, okay.
Yeah.
Okay.
So ginger tea, which I don't
know.
even know how you get ginger tea, but make
ginger... No, we had ginger tea, didn't we?
I don't know.
At the clinic, I had someone bring me...
Oh, yeah. It's a little difficult.
But I'm not a fan of that.
Yeah, but it does promote more fullness and calorie burning. And then another thing that's interesting that helps promote weight loss and helps fullness and helps with nutrients is vegetable juice. So, the things like should have had a V8. Really, there is some truth in that, honestly, because
Do that again.
should have had a V8. So those things, when you really look at V8 juice, it really does not have a lot of calories in it, and it is pretty filling. And when you think about it, it's kind of juice vegetables, so it does promote weight loss because one, it is kind of filling, and secondly, you're getting nutrients. So it's kind of a cool thing. It's not a lot of calories. The other thing is, of course, high protein drinks. So high protein drinks are another thing that helps promote weight loss, and that does it a little bit differently. So protein promotes fullness. It decreases hunger by producing ghrelin. So ghrelin is a hormone that's in our stomach that gets released to promote that sense of fullness, and that's the thing that causes the feedback loop of when you start feeling full after your stomach has been distended. So protein is one of those things that helps release that, and so that helps control your appetite as well. So that was another thing that they did. They compared people who ate, and it seemed like to be an arbitrary amount of protein that they came up with, but it was 56 grams of protein per day. I don't know how they came up with that number, but they did. But anyway, people who consumed more than 56 grams of protein compared to people who consumed less, and that were both trying to lose weight, the people that consumed more protein lost weight. And so their theory was about the ghrelin and the stomach fullness and all of that. So that's kind of some interesting little things there. I don't know how many can be applied. Probably the coffee, the black tea, the water, hopefully, the high protein drinks, veggie juice. I don't know about the apple cider vinegar as much as drinking, and the green tea. I mean, the ginger tea. The ginger tea is going to be one that I'm going to have to pass on for a little bit. So that's what I had to say about those two things. What was my next topic?
You wanted to talk about some patient stories that you
Some
had.
patient stories. So we had a couple of interesting patients this week, and they were all pretty similar. These were hormone patients, so they were patients, and they were female patients who had been put on bioidentical hormone creams by other providers. And what happened is they all had a very similar story. They were not seen by the same providers because they came from different areas of the country. So they complained of fatigue, low energy, low sex drive, and they were
while on the cream.
No, this was before.
Oh, okay.
Yeah, this was before, and then vaginal dryness, which is a common complaint in postmenopausal women when estrogens become low. And to guys, when you just hear that, you think it's no big deal, but to women, that's very significant. It's a very significant problem, to the point where, as you take some courses, you realize how really bothersome it is. So it's something easy to say, like, I have this dryness, no big deal. Well, this is the point that, women can't wear underwear because they're so uncomfortable, and their legs rubbing together causes them pain. So it's very debilitating. Yeah, when you sit and talk to someone, you will really get a new perspective on it, and it's really quite a bother.
So they had talked to their physicians.
So they talked to their physicians, and their physicians patted them on the shoulder and said, "You're just getting older, dear," and then gave them a small amount of estrogen cream, and most of them got put on progesterone, and that's where they left. They got their prescriptions filled and pretty much felt no better. And when they went back, discussed it with them, nothing really was done. And so that's kind of the norm. They get put on a set dose of medications. It's usually the same form of medications, a small amount of estradiol cream and some progesterone, either cream or oral version. And the providers don't follow up on it, how they're really doing. And people get tired of complaining because, one, they're already embarrassed about bringing it up.
Yeah.
Now they've gotten a treatment, and, they're kind of led to believe that that's all that can be done, and they didn't feel any better, and sometimes maybe even feel worse. So when they came here, most of them have not even had blood work done. We do their blood work, we find out what their levels are, and they're usually pretty low. So these patients did not want to opt for pellet therapy, and some people don't. So, they're really, for females, there's really a couple of ways of getting hormone replacement. There's the bioidentical pellets, which are testosterone and estradiol, which is a compressed form of that hormone that can be inserted, and that's a slow release. That's one way. The other is to use the bioidentical creams, a topical cream. And this is important because we want to use the bioidentical, not synthetic.
That's right.
Huge difference between synthetic and bioidentical. It's just I beat that one to death many times, but we want to stay on the bioidenticals. That's the hormone that totally mimics your body, and the hormone that's produced in your body.
Safe.
So it does not require metabolism. So when you start treating them, and another one actually had some testosterone, but it was just the basic of dose because she asked for it specifically, and this provider really didn't have any experience, so he just gave her like a smear of it just to basically shut her up. When I checked her levels, they were basically undetectable, both estrogen and testosterone.
And she was on estrogen.
And they were on estrogen, and this one was on testosterone. So I said, listen, you guys, if you want to keep trying the cream, we have to play with the doses a little bit, and adjust the dosages. And so really kind of increasing them until we get you feeling better. So that requires, an effort really on three people's part there. It requires an effort on the patient's part, who has to be very willing to want to do it. Because the biggest problem with topical creams is lack of compliance. And what that means is people will be really good at it for 2 or 3 weeks, then miss a dose, then all of a sudden they've missed 3 doses, and then all of a sudden they're kind of back to where they were. Because it requires some real vigilance with that, applying at the same times and doing all of that kind of stuff. But when done properly, it works well because it's a great mode of treatment. So the patients have to really be a part of it. So it requires 3 people to really be in concert here. And they all have to be motivated to get it done. The patient has to want to get it done and know that they're going to have some dose adjustments before we find the right one. The compounding pharmacist, that's critical there. You have to have a pharmacist who is comfortable compounding these hormones and has a good fund of knowledge of how to compound them and variations on the dosages. Because if you have someone that's unwilling to help you there, you're dead in the water, because these medications are only as good as the compounding pharmacist can make. And thirdly, the provider. The provider has to be willing to accept a lot of phone calls or a lot of visits, because the medications are going to be changed a lot. And that's where the breakdown is for most people there. And I'll take responsibility that providers, not for me, but other providers, don't want to be bothered with it. And so basically they give them that dose and hope for the best, or hope that they just go away. Because that's the part that requires a lot of back and forth, feedback. Is this working, that working, which is working? And then as you start making some progress, do some blood work to really assess where they are. So, and that's the thing. So when people start feeling better, you check it, and then really maybe even make some more adjustments to when they're feeling their optimum, and then check it. And then you kind of know where that person's going to be on their stuff. So it's a little bit of a process. And what's interesting is the doses that people are on are very varied. Some people require a very concentrated amount of creams to attain a small blood level, and some people require a very small amount of creams to receive a substantial level. So my point with all of this is it is very specific, and it's not just one size fits all. In fact, it rarely does. And so, but once you find that dose, people are very happy because they've gotten their needs met. They feel better because their testosterone is there. They have more muscle mass. They're losing weight. Mental clarity. They all notice mental clarity and feeling more motivated. Both of them really had no motivation. They sat on the couch all day, and really their husbands wanted to kill them because they didn't do anything. They were depressed. The estrogen, both people had marked decrease in their vaginal dryness, much more better skin production, things like that. And so those things are really important. And so those were a couple of key ones that was a little bit different hormone treatment that we normally get. And I wanted to kind of share that about how things are a little bit different, and how sometimes people don't just fit into that mold, but by going that little bit more, you can try and find
one step at a time and working with them.
You can find out where that right dose is for them. And that definitely is the same for thyroid. So thyroid is the same, we see a lot of people who are just put on thyroid, given a dose, and say, well, you should feel fine, without ever saying how. The basic question is, how do you feel? And other than that, there's nothing much more that we can do. We have to find out how they feel and what we're doing. We're doing something. How does it feel? It's like cooking. You put something. How does it taste? Cook something. How does it taste? And so that's one of the things. It's a lot of adjustment and a lot of feedback. And we get inundated with phone calls, honestly.
Yeah.
A big part of our practice is really just having one person answer phones, because we have a lot of people checking in all the time, giving us feedback about how they're feeling. And It's important though
I
because
don't
we
see
want.
any other way to do it, honestly.
Well,
You
I
have to
well
have
I know
great
how other
office
people are doing
staff.
it. They're
Yeah.
not doing it,
Yeah, they're
and
just
so
not.
that's the problem. We want to make a lot of adjustments, and we don't have to have people come into the office every couple of days or every week to get these adjustments. They can call. We've already pre-discussed what we're going to do, and then they know they're expecting it, and we move on that way. So just to let people know that even though you might be on some of these medications and if you're getting great responses, great. But if you're not, if you're on a cream or if you're on some other thyroid medicine and you feel like, well, this is the best I can do, probably not. Probably not.
You should be able to feel pretty good.
You should
We're making people feel pretty good.
Yeah. And so,
It just doesn't always take one time, though. You just have to be with the right physician, like you said, the right pharmacist, and be willing to be compliant and just keep working at it, and you'll get there for sure. But that's a good thing for people to know because we talk a lot about bioidentical hormone pellets, but we haven't really mentioned that women can get these creams if they're a little nervous or they want to try it a different way or they don't want to get the pellet just yet or maybe ever. There is another option in bioidentical. That's good to know.
Well, creams don't work well for men, so I just want to put that out there.
Okay.
It's not really an option, so it's pretty much only for women.
Yeah, well, good. Okay, we have a few more things to talk about when we come back. Hello, Cynthia Tieche here. We're coming back from break with Dr. Tieche from Recharge Clinic in Ocala, Florida. So we were just talking about thyroid and testosterone and all kinds of fun
And
stuff.
hormone creams.
Yeah. Did you have any more you wanted to add, or are you moving on?
Well, one of the things that I did want to mention about the female creams is, there's also different improvements by where the creams are applied,
Yeah, where do they typically apply it?
So that's the thing. So testosterone, really, they can apply on the inner arm or on their thigh. Now, depending on if they have children around or young girls, then that's going to probably depend. If it's a woman that doesn't have any kids around, they're probably going to apply it on their arm. If they do, they usually apply it on their thigh, and they usually try to make sure it's rubbed in before. That way it doesn't transfer. It's not as much of a problem with women's hormones as it is with men's when men used to apply creams.
You said, and that is not an option for men.
Well,
Talk
men's,
about that.
they started out when we started out with hormone replacement with men. They did a lot of creams and ointments. Some people still do that for guys. The problem is it's very difficult to achieve really any significant increase in their blood levels with that cream. The creams have to be, we're talking about getting guys. The reason why is there's a 10 times difference between men and women. So women, it's easier because we have a lower threshold of where we want to get to with these hormones. We don't have much, so we don't need to get as much in their system. For guys, we pretty much are lathering up their whole body with these oily substances to get them absorbed. Guys don't like it. They makes them sweaty. They break out from them. They don't get consistent results. And the worst part of it is they're very expensive. They are more expensive than any other form of treatment.
Really?
Yeah. And so, ironically,
Did you
when
talk about
guys
transfer? And how they transfer?
Well, yeah, ironically, when guys are in the military, that's the only form of hormone replacement they give them. Which is
Why is that?
It's crazy because when you think about it, it's like almost the backwards one because, they're going to be out there sweating with all this gear on. And we're going to lather them up with some kind of ointment to make them feel crappy. So anyway, that's weird. Yes. So really, another reason with guys it's a problem is transferring. Guys are putting this ointment on, they grab their little kids or they grab their wife. There's a lot of transfer
Or
of that.
Or
their dog's testosterone transfer. So there's a problem with that. Anyway, what I was going to say was with women, there's the application. So with women have the option to apply particularly the estradiol creams on their skin, but they also can apply it vaginally, which that's a lot of doctors do that, and some women really don't like that, and some do, and it is kind of mixed. But there's
Interesting.
well, it's kind of messy, So what happens is, you apply it that way, then it gets warmed up, and then it kind of runs out. So that's not a good thing. But the caveat of that is there's two things with that. Women can apply the creams to their labia and their outer 1/3 of their vagina, as well as over their urethra, and that is really where all the estrogen receptors are, the outer 1/3 of their vagina, and that's where it's going to really make a difference.
So they're going to have better results putting it
there? They're
there?
going to have great results there, because what happens is that is one of the areas that gets estrogen hormone starved, and that tissue, what we call atrophies or shrivels up a little bit, including your urethra. And so what happens is, as you get older, the angle of your urethra changes for women, and so they have much more cystitis, particularly after intercourse, so they have much more irritation. They get much more prone to bladder infections, and then they start having more leakage and stuff. So this helps kind of rejuvenate that tissue, but yet they also are getting systemic or blood absorption of this as well. So it kind of kills two birds with one stone, with getting a nice blood level and stuff, and so it works pretty well that way.
That's cool. I didn't know that.
So that's kind of a neat thing. I did want to mention peptides again. I talk about peptides a lot, and they're like growth hormone precursors, and they're like growth hormone release peptide 2, 6, samorelin, and ipamorelin. They all work a little differently. Some work by binding to the precursor thing. Some kind of are a hormone stimulating thing. But regardless, they all work to increase the level of growth hormone. And why is that important? Well, people don't want that, and you don't need it just necessarily to build muscle mass. People who've had injuries, chronic injuries, this definitely promotes healing. It helps your skin increase the thickness of your skin as we get older. That's one of the things that goes down. It helps heal muscles. It has a lot of healing factors, as well as just some of the good side effects. We talk about it always with anti-aging, but it helps wounds heal. It helps a lot of things like that. So people who have had surgeries and things like that, this is one of the things that really they can benefit from is this, and there's been a lot of studies with that. Some people that were in the hospital after they've had burns and things like that, they were put on low dose growth hormone and to help heal them, and that did help quite a bit. So what they did was they tried to replicate those same studies with giving them the growth hormone precursors, or what we call the secretagogues, that do that, and they've gotten similar results. So people are struggling with other little medical problems, well, not diabetes and things like that, but more fractures and surgeries or pain in the airways. These things can help, and they're worth a try for some of these things. So because they help promote healing. And even though we have most of our business is based on weight loss, there are some people who struggle with weight gain, and so they definitely help promote muscle mass. So they help promote weight gain, particularly some people who have chronic medical issues, and that's one of the things that works well for that. So I just wanted to kind of throw that out there, that these things work not just for one thing, only for making people look beautiful, but they also help actually heal you as well.
Interesting.
So,
did you, let's talk about tonight, even though this show is live on Thursday, but on Facebook, but then it's live on the radio on Saturday. So tonight, if you're watching on Facebook, we have the little Botox and Bubbly. We have a lot of people that have RSVP'd for it, but mainly because of the specials that we have. Galderma is letting us do some really amazing specials. If you're interested in face aesthetic type procedures, we've got specials on dermal fillers. Restylane is buy one, get one free. I put a little boomerang on there today of the Restylane. We've got Dysport. I want to talk about Dysport. What is Dysport for? Go.
Dysport is a neuromodulator like Botox, and what it does is it helps relax muscles, particularly from your eyes up. And so it works between the furrow between your eyes there, which is the glabella area, or the double 11s when people get that. It works with crow's feet, and it helps for wrinkles above your forehead, basically. It can be used in other places, but that's
the main areas.
That's the main areas. And what it does is we get wrinkles because that muscle has gotten stronger, and it's basically folding over the skin. When we put that in there, it helps relax that muscle a bit, and then the skin gets smoothed out, and so it helps kind of get rid of that.
So that's Dysport. it's people love it. They see great results with it. I think a fear that people have is if they've never had it before, they say, "Oh, I don't want to look crazy. I don't want to look fake." Not at all. And Dysport is actually known for a very natural look, getting rid of those wrinkles, but keeping your face looking natural. And really, when you get it, usually people comment on how refreshed you look, and your face is glowing, your skin is glowing. If you come rested. If you come see us tonight, we've got a few people that we'll have there that just got it. Have you seen Chloe's skin?
Mm-hmm.
She just looks glowing. Her skin looks really, really good. She just had it for the first time. We've got a guy there that Todd will be there walking around, and he's just had it. Big guy, great looking guy, looked great before, looks great now, but he just doesn't look so overworked now because it just kind of relaxed those certain areas. And of course, him injecting Dysport on a female is going to be different from a male. It's not all the same thing that we're trying to achieve, but it just really helps him make it look more refreshed. So those are some of the specials that we're having. Well, the Restylane is the dermal filler, but the Dysport is actually basically half off because it's buy one get one free. How we charge for that. So if you were to just on the average person give them Dysport for those crow's feet, glabella, and forehead, it's going to be somewhere around 100 units, right?
Correct.
And normally it's charged $4 a unit. So tonight, if you bought that, it would be basically half off. So it would be $200. $200 could correct these crow's feet lines, your glabella, and your forehead. That's a pretty darn good deal.
It's really good.
Yeah. Well, anyways, those specials are on our Facebook page in our event, Botox and Bubbly. Check them out. Come see us. Someone asked a question I'm going to answer real quick. What age starting Dysport? I would say as early as you have lines. So it could be early 20s. It could be mid 20s. It just depends on how you have your lines. But we do have early 20s that have lines. So come see us in Ocala, Florida. RechargeOcalaClinic.com is our website. And we'll see you soon.